Good evening, this is Heather Mattingly. This is my video response for discussion board assignment number 8. I wanted to give a quick background as to where all of this came from. So my established goal that I've chosen for this is one of the many skills that are required of the entry-level physical therapist assistant that is set forth by our accrediting agency, by CAPTE. CAPTE also has a complete list of standards that the program has to meet, and the required skills kind of fall into the standards, and they're all integrated together. So let me kind of give you an idea of what standards I'm hitting with this goal, which is a required element of the standards. So like standard 6D says that, the curriculum plan includes a series of organized, sequential, and integrated courses designed to facilitate achievement of the expected student outcomes, including the expected student learning outcomes described in Standard 7. Standard 7 is long and ridiculous and has a lot of bullet points. The curriculum includes organized sequences of learning experiences that prepares the students to provide physical therapy care to individuals with disorders involving the major systems, individuals with multiple system disorders, and this is kind of where my goal is hitting, individuals across the lifespan and continuum of care. So health to disease, including individuals with chronic illness. A couple of the other standards that my goal is going to touch on is that the PTA performs duties in the manners consistent with APTA's values-based behaviors for the physical therapist assistant. Yes, our accrediting agency and our national agency has decided that there's specific behaviors that we're supposed to follow, things like altruism, and the like. Another standard is that the PTA identify, respect, and act with consideration for patients and clients with differences in values, preferences, and express needs in all the work-related activities. Also, another standard, effectively educate others using teaching methods that are commensurate with the needs of the patient, the caregiver, or the healthcare professional, or the client. So they use the word client a lot because not only do we work with individual with pathology, so a bad back, a bad knee, fall problems, stroke, but we also, it's part of our scope of care to provide health and wellness and prevention education. So this is what my goal is based upon. And so the goal is that an entry-level PTA will be able to educate the public or patients about issues of health, wellness, and prevention. So, for example, the benefits of exercise, or the benefits of preventing or reducing fall risk. This is actually a required element for the entry-level PTA, and so this is my established goal. I'm actually developing a unit within my capstone course, so the students are in my program for 2 years. And so this course happens after they've pretty much had all of their didactic, after they've gone on one clinical rotation, they're back on campus for a little while. And so this is a health, wellness, and promotion unit that I want to develop for that class. And so that was my goal. The essential questions that I feel like I'm asking is, how is educating the general public different from educating our patient population? What different things need to be considered? What does the PTA supervision laws, what of those do we need to make sure that we're following in order to perform education to our patients and or the general public? Because a PTA can't act independently. They have to act under the direction and supervision of a physical therapist, a licensed physical therapist. And then, of course, how does the PTA know or recognize when education is needed or wanted? Just because we feel like it's necessary doesn't mean that the general public feels like it's necessary, or our patients even feel like it's necessary. And then what cultural or personal beliefs might be obstacles to this type of education. And so my desired understanding is that the learner will be able to understand how increasing overall health and wellness through things like exercise or prevention can lead to a better quality of life or potentially longer lives. Also, that the learner will understand the potential legal, cultural, and personal constraints to providing this type of health education to people. And so the key knowledge and skills that I'm hoping that they're able to uh, acquire is that the students are going to be able to integrate all of their past knowledge. So everything that they've learned in the 4 or 5 classes that they've, not classes, semesters that they've already had, 4 semesters that they've already had. So all of the pathology, all of the medication, and how it relates to physical therapy practice, integrate all of that as it relates. So students will be able to integrate prior learned knowledge about pathology as it relates to the practice of physical therapy to create and deliver an educational program designed to promote any or all of the following: so health, wellness, and or prevention. And so I'm hoping that they're going to put something together. So it could be like a verbal presentation, a group activity, maybe a video or a poster presentation. Any of that would be an acceptable format for this type of education that I'm seeking. So that's what I'm looking at doing. It's a work in progress, but that's where we're at thus far. Thank you for your time.